Children's Health Access Program is critical to reducing the health disparities, particularly for children of color who are disproportionately represented on Medicaid rolls. CHAP is supported by foundations and health plans and providers working together. And policymakers must make smart policy decisions to ensure that there are enough reimbursements for the providers of health care. And they've shown in Grand Rapids that this actually saves money in the long run. The Priority Health has put in hundreds of thousands of dollars to make up the difference between what Medicaid provides and what the doctor actually needs to provide the service. They found out they didn't really lose money on that. I'm sure we got someone from King County to talk about that today. So they've spent money, but they've saved money from fewer hospital emergency room visits and better health outcomes, better management of health issues for kids. So we need to think about how our county's kids can be surrounded with a medical home model. It is the way in which we're going to help our kids before they have to get arrested in order to see a physician. So I appreciate this opportunity. Again, my hat's off to Jametta. This group is fantastic. We're at the cusp of something really special here. A medical home for every child in Wayne County is our goal. I know we're going to work on getting 10,000 to 15,000 kids enrolled in the next couple of years. But without that, we're going to continue to see kids failing, the outcomes for children of color to be worse than others. We need to step up. We need to speak up. That's the other point here. They need to hear your voice in Lansing. My voice is one voice, and they can tune me out very easily. But you need to be in touch with your representatives and other officials in Lansing. A good way to do that is to be on our website so you'll know when it's an opportune time to make a point in a polite way with your elected representative so they understand the issues that are at stake. You know, a lot of these new legislators, they're not familiar with medical care, they're not familiar with pediatric care or foster care or children's issues in general. You know, they come from various backgrounds, including farming. And I have nothing against farmers, but they're not experts. You all are experts. Your expertise needs to be heard because you know what's going on in the field with our kids not getting the adequate medical care that they need to get to adulthood, ready to have a career, ready to raise their families, ready to be tax-paying, law-abiding citizens that this state and this community needs. So I commend everybody here for being here because I know you're concerned about children. I know you want to do the right thing. Just let us help you connect to the elected representatives to help you do that. And thanks very much for being here.
Thank you so much, Jack. You have reminded us of the importance not only of advocacy, but you've also, in some ways, you kind of threw down a gauntlet to us. And the reality is that we stand in the gap. We are the ones that are here to make a difference for our children. And if we are willing to write letters, to read, and to advocate, if not us, then who? Because we're to do that in partnership with parents, but certainly all of us here need to say that advocacy is part of what we do because we want to ensure that our children have a better future. So thank you again, Jack. We're going to start our program officially now. And I think maybe officially I should introduce myself. My name is Jametta Lilly, and I have the wonderful blessing, and that's what it is, to serve as the project director for the Wayne Children's Healthcare Access Program. However, this is no solo endeavor or initiative. The very notion of the Children's Healthcare Access Program is a partnership. And so importantly, it's a partnership between a medical director and a project director working with diverse entities in the community from primary care practices, education, mental health, early care and learning, foundations, the business sector coming together. So with that, I'd like to let you know, some of you haven't had a chance to see her, or maybe you've just seen a white coat just go, and then you turn around and go the other way. And the person who wears that white coat, but in no way does that absolutely define the dynamism that she is Dr. Teresa Holtrip. And I have to share with you, I think I shared earlier, that the Wayne Children's Healthcare Access Program is an outgrowth of the strategic direction that the Early Childhood Investment Corporation established some 6 years ago. And when they beat that drum, us folks down in Wayne County started moving to that rhythm. And in February 2009, the Pediatric Family Health Action Team went to an ECIC conference on what was called a Medical Home Summit. That's in fact where I first met Jenny Salisa, and also we had a chance to hear Jan Olszewski, the previous executive director, and all the political people that you, Judy Samuelson, brought to the table. But there was someone in the audience with me, and that has been a person. I want all of you to know that the Wayne Children's Healthcare Access Program could not exist without her passion, without her commitment, and us sharing emails and visiting each other at odd times in the morning. Physicians do this, 7:30 a.m. in the morning, and others. I would like for all of you to please welcome and give a round of applause to Dr. Teresa Holtrip, the WCHAP Medical Director.
Thank you, Janetta. When we went to that meeting in February of 2009, Janetta and I looked at each other and we said, there is absolutely no reason why we can't have the same kind of program here in Wayne County. And it's taken this long, but we've gotten it together, and we are extremely grateful to the folks from Kent County. I see Maureen Kirkwood over there, who is the program manager in Kent County, and we'll be speaking a little bit later. We're extremely thankful to Jenny Salisa from ECIC and Judy Samuelson for your support in all of this. I am also, there are other folks here in the audience who have also played a role. Dr. Charlie Barone is here, right over there, and he is the immediate past president of the Michigan chapter of the American Academy of Pediatrics, and has worked very closely with us in providing statewide support to our efforts here. I understand we also have a representative from Hanson Clark's office here. I'm not sure where you are. There you are, right over here. Thank you so much for coming. I wanted to give you just a very brief perspective of what this whole medical home project is from a physician's point of view, because you know, you hear about medical home, it isn't as if we haven't had physicians here in the city of Detroit and in Wayne County. It isn't as if children on Medicaid haven't been able to get to the doctor, so what's the big deal? The big deal is this: when you are insured under Medicaid, that automatically means that you are low income. That means that you are dealing with a ton of different stressors that might make life a little bit more complicated than one would hope for. That means that if you are a physician in the city of Detroit or in Wayne County, seeing the vast majority of your patients are Medicaid patients, you are really working hard to try and make a go of it. And the reimbursement is borderline. It's very difficult to run a practice as a good business. And that's really the reason why it is so hard for us to establish new offices here in this area, and to have the same kind of ratio of patients to providers as exists out in the suburbs. So all of us who have worked in this community in pediatrics have felt the financial constraints, and that is on top of all the emotional and just structural system issues that we have to deal with, that makes it very, very difficult for us to provide all those different aspects of a patient-centered medical home that we would like to offer. All of us want to do what is right. We want to be accessible. We want to provide coordinated care. We want to provide comprehensive care. It is extremely difficult, though, to do that. The health insurances that insure our Medicaid children, and there we are dealing with roughly about 7 here in this area, have the same kinds of challenges. They are obligated to make sure that the children that they insure are getting the kind of health care that, a good quality health care, and so they harangue us. Are you getting your immunization rates up? Are you getting all the kids screened for lead? Are you getting them in for well child visits, et cetera, et cetera? And yet we are left with very little with which we can try and actually make those improvements in our practices. So that is what WCHAP will do. WCHAP has a team. Many of them are here today, and I hope you get a chance to meet them all. We will be working with the individual practices, and we have 8 practices at this point from around the city and outlying Wayne County areas that have agreed to participate in this. We will be working very closely with Health Plan of Michigan at this point, has agreed to participate and is providing incentives. In addition, we are having some very exciting conversations with Omnicare, as well as with Great Lakes Health Plan, so we will see what develops there. But we will be working very, very closely to help everybody improve the kind of quality of care that we really want our children to be able to receive, and at the same time what we saw happening in Kent County and what we expect will happen here is that it's going to become a whole lot more fun to be providing pediatric care. At the same time, getting to know what all those other systems of care are out there and being able to make sure that our kids get referred to those other kinds of support services that are available, not just the kids, but also their parents and other family members that require it. What has happened so far has already been extremely exciting, and I really look forward to seeing this come into full bloom. Thank you.
Thank you, Teresa. I'd like to add just very quickly as we go through the program, this particular slide. One of the things that Jack spoke to, and certainly Teresa did as well, is that this is the result of some strategic thinking. That programs are important. What we do at Ground Zero is important. But the Children's Healthcare Access Program is not only about improving individual or family and program and community health. We are very concerned that we work together to create systems change. And the only way you can begin down that very difficult road is to have some significant partnerships. So we want to just again acknowledge the entities that have been part of not only our journey, but also where we're going to. And so if I could, I just want to go through the list very quickly because I know some of you have to leave, but we really want you to celebrate with us, because that's what today really is. It's a moment for us to celebrate as we are rolling up our sleeves even more to get to the work. But in particular, we'd like to know that you know that the Department of Health and Wellness Promotion has been integral to our work. They are also going to be what's called a preferred referral partner. We will be referring folks and linking people, very important, continuity of care for maternal infant health programs and also Healthy Start. Detroit Public Schools. We're in this room, we're in this place for a reason, because we know that health is a fundamental part of school readiness and school success. And yes, we could have probably done this in a hospital, but we purposely said we are about health and wellness. So we wanted to come into an environment that says education is important and that health is a fundamental underpinning of good health. We also want you to know that we're so delighted, one of our strategic partners that we came to very early, we knew we needed to have someone in the health community that wasn't a particular health system or particularly designated this or designated that. And so who fit that bill of being a convener of multiple systems, and in particular multiple partners around health? And that was none other than Chris Allen, the CEO, and his team, the Detroit Health Authority. My apologies. And one of the things we've been laughing about, the Detroit Wayne County Health Authority, all of us, and I'm looking at Vita when I say this, all of the agencies that have that super long name are doing smart things like now, simply becoming the Health